Yeah, quite a few things. Have a few things that we're going to be sharing with you this morning. Want to go ahead and launch in. Want to keep us on time and on pace so we can move forward. So, as always, good morning. Happy pre-Friday. Saying that out loud gets me through the day, knowing that there's one more this week. It's been a long one for many of us, and I'm sure some of you as well. And then, of course, then we go from summer one week to fall the next. So we are definitely in the thick of what we would call Chicago weather, both today and tomorrow. And so one of the things that I want to say that's not on the agenda here is asking everyone to be mindful around heating and what's going on within your facilities, and letting us know if you're having any issues around heating. It's supposed to drop again tomorrow and will be even colder. So we just need you to keep your eyes on that, letting us know if you're struggling, if you need any assistance in any way. Because we do know that, cold facilities, and I'm sitting in one right now where I'm not even able to occupy my office for more than a couple of minutes because of heating issues. And so it not only happens in yours, but it happens in ours as well. And I do know that people get sick in facilities when you don't have the right heat and the right temperature. My joke around here has been, you just don't let old people sit in cold rooms. That's when their bones start to ache, and mine has been aching a little bit this week. So I just have to find some humor in it. B, I see you laughing. Got to find some humor in all of this, but we're going to make it through. So let's go ahead and get started. So holiday plans. We know that we are a week away from Thanksgiving as of today. So I'm hoping you all have some plans to spend time with family and friends, and to just spend that time that we've been missing for the last few years. But we also need you to let us know here at DFSS. You need to let your team leads know about your schedules and holiday plans and closures. I know you do your schedules, but we do ask at this time that you remind us of what your plans are over the holiday season, especially in December, about any closures that you have plans, just as a reminder to the team leads, letting them know what your schedule is going to look like. The reason we're asking you that is if there's anything that's going on in community, we need to know who's open and who's closed, and what days they're open and what's closed. We know that we're in the thick of winter, and we could get snowstorms and all kinds of things that happen. So we need to know who's open and who's closed. So if we're trying to triage, what do we need to triage in what community? So again, as a reminder, if you can let your team leads know what your holiday plan schedules are for any closures that you have. And as a reminder, if you're closing, I hope that it has already been communicated to your parents, because they need you there. They're able to plan their holidays when you plan yours and give them those days early enough. So I'm going to make assumptions on your part that you've already communicated your holiday plans to your schedule changes, if any, to all of your parents that you are servicing. So I'm just going to move from that. I know that everybody's trying to work with us on CSD Cares, and I thank you, first of all, for working with us as we're working to get our system complete. We're not there yet. We are rolling out, and we'll be looking at the HR module in the next few days and trying to see where we are with that. And so we do need everyone, all of you in the sound of my voice, who's operating programs under DFSS Children's Services Division. You all should be doing all of your documentation and enrollment in CSD Cares. That's where the system of record is. That's where we are looking to see what our enrollment numbers looks like. It's where we're looking to see and verify attendance. That's what we're looking into, and that's the system that my team needs you to be putting all of your information in. I do know that there are some people who have not. I know some people are struggling, and I know I have had staff, and I'm seeing the emails that they're continuing to work with you to get you into the system so that you're able to use the CSD Care system. I'm going to send out an email. I see the question in the chat about content areas. I'm going to send out some updated information, letting everybody know what's available in CARES. We've done a lot of work since August. Actually, we've been working on it for a while, but since we stood it up in August, we've been doing a lot of work making sure that different pieces came online at different times. So we're going to send out some updated information so that you can see it. trainings are available, and we need people to be doing the trainings so that you understand how to use the system that is now our system of record. I do need to know that if you are having some struggles, I've said before, you can CC me on the email. That way I can keep my eye on it and see exactly when and if people are getting what they need, so that we're able to make sure that you're able to get into the system and do what you need to do. One of the things that we are asking everyone to do right now with CSD Cares, if you got PFA and PI, is to go in and complete the records. The ISBE report is in there. All of the clarifying and required fields are in the system. I thank you first for those of you who were doing some records offline, but we've been able to import most of that information into CARES, and so you should be able to go in and just finalize those other fields. Reminder that each month we have a report due to CPS, so we do need people to be keeping it up to date. We do know that there's some children who we are working with agencies right now because we are not able to find them in what is SchoolMint, is the front end or the application system. What I want to say to all of you, if you have children and the teams are reaching out to you, one of the things that we said this year was you needed to put all your families into SchoolMint, putting them into SchoolMint, and we gave agencies access to help parents. So parents can put the application in, but staff have access to that system as well and can work with a parent to get that application in. That application is the front end. It goes into the system and generates the child ID. And so if they're not going through the SchoolMint system, those IDs that are necessary are not being generated. And so I just want to make sure I say that out loud so you understand if people are reaching out to you, what it is we're asking you to do. Again, it's the front end of the system. Is that SchoolMint application where IDs for children and families are being generated. So we need all children in that system. So I'm going to go ahead now, and I'm going through mine a little quick, and I apologize for that. We do have a presenter. She's due to start at 11, so I want me to be able to get through. I want most of the staff to get through theirs, and then we're going to turn everything over to Dr. Funk, as it says here on my agenda. I do want to take a moment to talk about URSEA for the federal grant. Specifically, if you are enrolling children in the systems at your site for Head Start, Early Head Start, Early Head Start CCP, Early Head Start expansion, then you need to be using what's called relevant time period. What is relevant time period? What it means is the year before you enroll the child. For example, if I'm enrolling a child today on the 17th of November, I need to be talking with that parent and finding out what was the financial circumstance for their family. Were they working? Were they getting TANF? What were they getting? Were they not working over that time period? But the time period that you're looking at is the 12 months preceding the enrollment. And so I'd be going all the way back to November of 2021, working with their family to find out what was the financial circumstance. And again, what were they getting? Are they getting TANF? Are they getting SSI? Were they employed? Were they not employed? What's on here allows you to go into the Head Start performance standards, and you can look and find out exactly what it is. What is 1305.2, which is relevant time period, and then how do you determine, verify, and document eligibility? We have to follow the rule, and that's the rule. The rule has been on the books since 2017. What they have told all reviewers is to begin to look at all eligibility files based on relevant time period. We worked with our EHS expansion. We're working with our EHS CCP, and I know my teams are working with all of our funded agencies on relevant time period. And so if you have questions, don't hesitate to reach out to the person on your team, or if you want more information, please look into the two things that I have here on the screen. This is going to be in the document that you'll get, and you can reference it later, but 1305.2 are terms regarding relevant time period, and in 1302.12, determining, verifying, and documenting eligibility. For example, if a parent says that I had no income, a letter where that parent states that I was not employed and had no income from November of 2021 to November of 2022 covers the relevant time periods. That's the year preceding the enrollment for that particular family. And again, this is a rule. They are looking for it. They are actually reviewing and ensuring that we're following that. And so want to make sure that I put that out there again and make sure everybody understands that it is a requirement. Dorothy, I do see your hand up.
Thank you for recognizing. We are clear on relevant time period. However, in my readings in the eClick and IAMS and frequently asked question, what I saw was relevant time period is not required for those families who may be considered categorically eligible for SNAP, homeless, foster care, and etc. I need you to confirm that. Income eligible families, yes. And if not today, you can just send out a correspondence.
No, Dorothy, I'm sorry, I'm having some technological difficulties here.
Okay.
I'm trying to unmute, so I apologize. I'm
Okay.
working outside of my office and having some issues with this computer. You're absolutely right. When you're looking at categorical eligibility, you're looking at that family a little bit differently. Categorical eligibility allows you to determine eligibility based on that one issue. If I'm saying SNAP, you are eligible for SNAP. SNAP has been determined as a result of your having received SNAP. You're eligible for the federal grant fund and then enrollment in this program. Same thing for homelessness. And so what we're asking people to do is definitely following the rule, following the mandate. When it comes to income, and that's why I was saying income, if you're looking at income, were you working? What income did you have? It's no longer okay, for example, in the employment side of it, to take 2 check stubs and then multiply it and then determine that year of income. What you have to do is get enough income in verification from the family to determine that 12-month income. Tax statements, for example. To your question, yes, Dorothy, categorical eligibility determined at the point of entry allows you to go ahead and enroll that family based on that category that you've determined that they're eligible for. Thanks for raising that.
Thank you.
You're very welcome. I don't see any other hands up. I was going through as we're doing this, trying to go to chat as well. How does that work for EHS/CCP programs? It's all programs under the federal dollar: Head Start, Early Head Start Child Care Partnership, and also Early Head Start expansion. When you are enrolling them, you're looking at their eligibility for that previous 12 months. And so it is for all of those programs where we are enrolling children using the federal dollar. Looking through, I don't see any other questions. I'm going to go over and turn it over to the next person who's going to present. To everyone, I'm going to be minding time on my side so that we're able to let Dr. Funk come in and do her presentation at 11. So everyone go ahead, and if I have to chime in to stop someone, I will be doing that and then turning it back over to whomever I have stopped in the process. So program admin update.
Good morning, everyone. Welcome. So as you know, this past Tuesday, we did have our CPPC elections. We were able to elect a chairperson, vice chairperson, parliamentarian, and a community rep. So there are vacancies available. So during the January full council meeting, any eligible parents are able to run during that time. The next meetings will be held January 3rd and January 17th. So with that, there are a few agencies who are missing letters of certification. My team has sent several emails to your agencies, and we're missing that. So after this call, we will send out follow-up emails because it's imperative that you email those documents. They are required to be on file for your Head Start program. So if you have any questions, I'm going to put my email in the chat, and you can send me any questions you have about those letters of certification, as well as your parent committee tracking forms. Thank you.
Good morning, everyone. Just a couple of reminders under health and safety. The first is we've been receiving lately many requests for cooperative agreements. Those cooperative agreements, as you know, are templates that DFSS puts out to assist you with contracting with a medical, dental, mental health, nutrition provider. And so I've spoken to Dr. Sally, and one of the things that we're going to do is be reviewing those templates for any updates that need to be included. This is one of the things that I've asked her to focus on in the upcoming health subcommittee of the HASAC. And so we will get you those dates out when they've been confirmed. Hearing and vision reminder. If you are utilizing consultants to conduct your hearing and vision screenings, if you could please send to Angela Hughes their certifications. They have to be certified in both hearing and vision through the state of Illinois. And so those are the only people that should be doing your screenings other than us. Just also want to remind you that we're still in the days of COVID and RSV and all these other communicable illnesses that are out there that I'm sure the doctor will speak of a little later. So just want to remind folks about cleanliness, hygiene practices, masking, social distancing, because we are expected to see another uptick in COVID. If you are experiencing COVID at your centers, remember that you should be sending us those reports. Send those reports to your team leads. Bus evacuation drills. Continue to submit those forms for bus evacuation drills. You're going to send them directly to the email address that's on the screen, to Ms. Hicks at AM Bus Company. What will then happen is after they schedule a bus evacuation drill for you, they will send you back a receipt after that's been conducted. And then those receipts need to be emailed to your team leads. Referrals for evaluation to CPS. We've seen a slight increase in the number of referral packets that we have received. I think a couple of weeks ago at the beginning of November, we were at 22 referral packets that have been sent in, and this is 0 to 5. We are now up to 39, which is good, but you know, please inform your DSCs at your agencies that tomorrow is the due date for submitting those referral packets into Nancy and Andrea. We know that we have a number of those that still need to be completed because they're missing information. But we want to get as many of those packets generated and into ODLSS so that we can schedule those children up before the holiday break. And then when we return after the holiday break, we will be again expecting disability service coordinators to complete those packets and submit. And then lastly, background checks. DFSS is creating a secured email box so that we can communicate directly with those agencies that have been impacted by staff who may have failed their screenings. DFSS only receives a status of pass or fail. We don't have any other information beyond that. What CPS has been doing is communicating directly with your staff. And so our expectation is that your staff have then been communicating with you. And so in order to ensure that this communication has been going on, we want to set up our own email box to communicate with your HR folks. So expect that information to be forthcoming. And let me check the chat box to see if we had any questions that I might respond to. I don't see any, but if you have any, feel free to send it in the chat box and we'll get back to you. All right, thank you. Next presenter.
Hi, good morning, everyone. Sorry for the delay. I'm Nicole Roberts with the Department of Finance, DFSS Finance, and I will be giving you the finance updates. So our current expenditure rates for federal FY22, Head Start is 64%, Early Head Start is 50%, CCP is at 53%, and expansion at 49%. And for our state-funded grants, the Early Childhood Block Grant is currently at 9% and childcare is 19%. For our federal FY22 grants, the teams are currently reviewing and processing all of the supplemental budgets as well as the COLA budgets. Our goal is to get those completely approved through the comptroller's office by mid-December. So that will allow sufficient time to get all remaining outstanding invoices submitted by the January 20th deadline. If you foresee any issues or if you are experiencing further delays beyond the mid-December date, please reach out to me and we will work with you on that. For FY23, we are still under review with the funder for the grant application. The teams are planning some future trainings. So some of you may recall, you were with us in 2019 and prior, we would hold sessions for budget preparation training. So our goal is to start those back up as well as invoice trainings. So please be on the lookout for further information to come in December for that. And for our state-funded grants, childcare and ECBG, invoices should be submitted through the October 31st period covered. Please continue to submit your invoices on a monthly basis. We will be reviewing and analyzing expenditures. It is very important that you submit those as timely as possible. We will continue the outreach if we see that you are underexpended or if you are missing any invoices. For these grants, please keep in mind that any invoices related to the calendar year 2022 must be submitted by January 20th, 2023. And I just have here a link to the iSupplier training. So those are general invoice submission trainings. There is a new site form requirement. So in addition to this iSupplier training, we will go over a more detailed invoice training in December for early learning. And I have here the finance contacts. Just another reminder that Monica Almanza is no longer the accountant over the ECBG PIPFA grants. So at this time, please continue to reach out to Sharon or myself if you need anything until further notice. Are there any questions?
I don't have questions, but Nicole, I do want, if we can go back to the slide where you showed the expenditures for the federal grant. So we are at the end of November. Today is the 17th of November. We only have about 13 days left in this month. And as you can see, we are extremely underspent on each of the grants. November being the last month of this contract year, we're only at 64%. Early Head Start only at 50%, CCP at 53%, and EHS expansion at 49%. I'm sure you can look across the board and you can understand how much money then we're looking at that's not going out the door. I'm going to make some assumptions on this, that you guys have invoices that you have not submitted. We need you to make sure you get all of your invoices into the system so that we can have a better idea of where we are. If you have some invoices right now that you're readying to get into the system, send me an email and let me know what you're about to put in the system so I can communicate with the team where we are. One of the things that we're going to start doing is we're going to have more intentional meetings with all of you about invoicing, because getting to the end of a fiscal year and having only a few days left in the funding year and being at this percentage is a concern. And so we are going to go back to one of the things that is in the boilerplate. The boilerplate asks that we all invoice on a monthly basis. And so we are going to come back, have more intentional conversations around that. As Nicole mentioned, there will be trainings that will be done to assist with some of this, but we have got to be able to get more of these dollars out of the door. I know that there are issues around staffing and some other things. So believe me, I understand some of the things that's going on your side. But again, we have to have more detail about the why, as we're especially getting to the end of a contract period with these percentages being what they are. I did not want us to move forward without you hearing the concern about that, so that we could talk it through. We will be meeting with folks and talking about it and trying to figure out what some of the circumstances or issues might be with the monthly invoicing, because again, it's the only way for us to keep up the detail that we need to find out exactly where we are, especially at times like this, when we're nearing within 13 days the end of our federal fund. So more information to come, more meetings to be requested. And thanks, Nicole, for your presentation.
Thank you, Sarika.
So one of the things that we want to say is we are still working, as I said, as I started off with CARES, we are still working with CSD CARES, standing it up, but don't forget to register enough. Don't forget to have your staff register for trainings, and we're putting it out in the CSD update. We still have the team here working to get people into the system. It is what it is that we are now pushing and pushing and pushing. We started this system August of 2022. It is November of 2022. And I do know from meetings that I have some agencies that have not begun using the system, which means our enrollment is having to be hand counted, and we can't continue to do that. We need to have everyone in the system, so the system of record allows us to publish the required reports. Let's work on your end when we're able to do that. Let's work on my team's end, but also less room for error. So I am asking everyone to work with us and make sure that your staff are in the CSD CARES system, that they're standing up the classrooms, enrolling the children, and making sure that you're putting in attendance, et cetera, et cetera, et cetera, in the CARES system. It is our systems management system. It is what my team uses. It's what I use, because I go in and I'm looking as well, and I'm seeing myself where agencies are not up to date and are not doing what it is that you're required to do as far as the data system. COPA is no longer our data system of record. All enrollment for Head Start, Early Head Start, PFA, PI, all of that needs to be done in the CARES system. I know there was some confusion when we started this, and that some of you are also CCAP funded, and that CCAP system remained in COPA. HR also remains in COPA. And so we're trying to get those two systems complete so that they are be active in the CARES system as well, so that we won't be confusing you any more than it confused some of us. But I just need everyone to work with us in using the system that we have of record, letting us know what your issues are, what your needs are, so that we can work with you. We're your partner in this. We want to make sure that your team is able to be effective on your side, because we know you need to use the data system for your reporting internally as well. And so we've all got to get this done. We've got to get it up. We've got to get this plane that we've been flying. I talked about it before. We're flying and it's not completely built, but we took off in August, and we've been, circling Chicago for months, and we're still circling. When we land finally at the beginning of next year, where we have stood up all of these different areas of the CSD system, my expectation is everybody's going to be fully trained, is fully operational, and all of your staff are able to go in and use it and do exactly what it is we need you to do in the system on a daily basis. So I understand the complications. I know that there's some things out there that we're still working on. All I'm asking you to do is continue to work with us as we continue to work with our vendor to make sure that we're able to do everything that we need to do. Dorothy, I see your question was the date of transition for HR and CCAP. I don't have the date yet. Once they finish the modules, we preview the module, we make sure that we have training attached to it so that everybody understands how to do it, and then we will let you know that it's live. And so it's toward the end of the month that the HR piece will be there. We will be reviewing it, making any necessary edits to what's been built out. Then we will make sure that people are able to be trained on it, and then we will consider it live. So it is coming, we're not there yet. Can you please resend out the training meeting that was specific to CSD for PIP home visiting? I will ask my team, and if you're hearing my voice, team, please make sure that you send out the information again regarding the training that was being done specific to PI home visiting. Let's see, I'm trying to see what other questions I have. I think I saw one in here. I think it was from Will. Roniel, your question about CARES, CURSA, I'm working with the team now on making sure that we have the correct dates for use for those funds. So information is going to be coming out regarding our CARES and CURSA budgets. And so we will be giving you some updated information about the timeframes around those. We were with our regional office yesterday, for example, and trying to clarify some of that information. So there will be some information coming out regarding that. Looking back, and I'm not seeing any other questions in the chat box. If we could check to see, Mara, if you can check to see if Dr. Funk has joined. I know we said 11 o'clock.
She actually just joined this very second.
Oh, perfect, perfect. Dr. Funk, we are completing our agenda a little bit earlier. And so if you are ready, we're going to go ahead and turn it over to you so that you can do your presentation. Again, Dr. Funk is here from Chicago Department of Public Health, and will be talking to us about making sure that we are understanding the needs around some of what we know is impacting all of you and your programs out there because of the age of children that you serve, and wanting to give you some updates from Chicago Public Health. And so I'm going to go ahead. Dr. Funk, are you ready?
Yes, I'm just going to bring up my my slides and a
Perfect.
couple of resources, and I'll be ready in just a few moments.
Perfect.
Thank you all for having me.
Thank you.
Can you all see my screen? With the presentation on it, the right one?
Yes.
Great, wonderful, thank you.
Yes.
All right. So thank you all for having me here. I know that we've had some previous meetings. And I'm really glad to kind of present now about some of the needs of early childhood with regards to health. So my name is Dr. Michelle Funk, and I'm the medical director within youth settings here at Chicago Department of Public Health. That's part of the Disease Control Bureau. And yeah, I'm happy to be here. So I just wanted to talk a little bit about pediatric respiratory diseases, and then we're going to talk a little bit more as well about some resources that are available to early child care centers. So everyone obviously still has COVID on the mind, probably not quite as much as they have before, but just wanted to kind of go through this a little bit. So as a reminder, back in February of this year, as we started to understand a little bit more about kind of how the disease dynamics can potentially affect our communities. We've come to this understanding of community levels and indicators. So low if we're in low disease burden, meaning hospitalization is not being significantly affected and not a lot of cases. Medium if one of those parameters is elevated, but not the other.
Dr. Funk.
You're both. Hello?
Dr. Funk, I apologize. Your slides are not advancing.
Did you see this? You didn't see any of the slides advancing?
What we see the first slide, the early childhood working group, but what we don't see is not moving forward. You are not in presentation mode.
Let me fix it here. I'm gonna stop sharing for just a second.
Okay.
And then I will fix that for you.
Thank you.
Sure. Can you see that?
Yes, we do.
Okay, great. If something changes, let me know. Okay. So talking a little bit about COVID, can you see this page?
Yes.
Perfect. Okay. So talking a little bit about COVID, again, we're just trying to understand largely the burden on the hospital system. So, there's going to be a lot of, cases that are either asymptomatic or have mild symptoms, but then there are cases that are going to have a significant impact. And so broadly, just thinking about that in terms of both indicators can help us determine what community level we're at. And right now we're actually at medium level, and this gets updated once a week at the CDC. And essentially the CDC actually looks at the county that people are from. So in other words, we are part of Cook County, and Cook County is at medium currently. And so for that reason, Cook County, City of Chicago is also at medium. You can still see that our goal for the number of new cases per 100,000 in the last 7 days is less than 200, and we're actually pretty significantly lower than that for both the City of Chicago and for Cook County. But our hospital admissions per 100,000 population is actually a bit elevated for Cook County, and that's why we're in medium. And the way that this is really calculated is kind of keeping into consideration regional hospital availability, because obviously if all the beds in, for example, Evanston are full, then there might be some diversions to Chicago. So it does make sense to kind of think of this in terms of the entire community. And that's how we're in medium right now. And this is actually from a couple weeks ago, but I think it just does this just to show. So COVID's not the top of mind, I think still, even though that we're in community, we're in the medium community level right now, but it's also not over. And just this slide is to point out that we've had a lot of our major peaks since, aside from the original peak during the winter. So 2020 to 2021 and 2021 to 2022. And you can see that things were pretty low and then had a pretty steep slope upward. So in other words, you know, this is in terms of deaths per day, as well as just in terms of number of cases. So it's something that as we're entering the winter season, although it's not the top of our mind, it's something we want to continue to be aware of. And this is up to date. So as of yesterday, 48,538 COVID-19 hospitalizations have occurred in Chicago. And again, you know, just keeping track of the fact that a lot of our peaks have been in the winter time. And so we just want to be aware of that. So that's one disease that we're worried about. Another one that I think a lot of people have probably had to deal with in their childcare settings since probably September of this year, maybe even a little bit earlier than that, is RSV. Okay. And you probably are all familiar with RSV from previously before the COVID pandemic hit. It's a common cause of acute respiratory tract infection in all ages. But in particular, those who are under 2 are most likely to have the most severe illness. And most people under the age of 2 have their first infection. And it circulates in the fall, in the winter, and the spring. Many children have cough, fever, irritability if they're an infant, runny nose, and congestion. A lot of times when it's those kind of copious nasal discharge, so that way there's like a constantly running nose. But in some circumstances, children who in many cases have been otherwise previously healthy may have things like bronchiolitis, which is kind of those lower airways becoming inflamed, and sometimes pneumonia. And so obviously there is a potential for this disease to be very serious, which is kind of what's happening here. So I just wanted to kind of use this slide to highlight, first of all, that RSV is not a new disease. It's a disease that we've seen for a very long time. It's just that things are a little bit different right now because, well, so basically, there's a variety of reasons for that, but you can see essentially that there's a huge surge in childhood respiratory illnesses and hospitalizations. If you look at pediatric admissions at Chicago hospitals due to acute respiratory illnesses, so this is not just RSV, but other illnesses. If you look from a year ago, and then compare that to now, there's been a huge spike in the number of admissions. In particular, respiratory syncytial virus, RSV, is contributing to this spike, but it's not the only thing. You know, there's rhinoviruses, there's enteroviruses, there's other things that have that can cause kind of cold-like symptoms, but in some people can be very severe. And one of the things to point out is that, you know, a lot of children up until this point maybe have been you know, essentially quarantining, so they haven't had necessarily an exposure to this virus before, or, you know, that they are now kind of in the school or early child care setting. And so in these circumstances, there's just a little bit more space for viruses to spread. And so for that reason, essentially, all of these children who had not gotten sick kind of, you know, at the same year that each child would get sick are kind of all getting sick at once. And so this is part of the thing that's contributing to what we're seeing right now. And so that's one other issue. And then I guess the other thing, of course, is influenza. And so I just wanted to point out there are maps that you can kind of follow on the CDC's website. But essentially, this is looking really at all influenza-like illness. So essentially that combination of kind of fever and cough and mild respiratory signs essentially this activity is tracked. So it's not necessarily because of influenza virus, but anything that could kind of contribute to that. And you can actually see this across the country and see that, there's already parts of the country that about 2 weeks ago had pretty high flu-like activity. And in Illinois here, we were at like low to moderate. And then just a few weeks later to highlight, so this was ending the week of November 5th. So the last official full week, essentially having kind of this spread. And now even Illinois is starting to kind of get into moderate to high flu-like activity. So I guess just the point here is that we have multiple respiratory illnesses potentially at play. With RSV already taking over, many pediatric hospitals are very full with RSV. We also do have COVID, which is just moving into medium level and still hasn't kind of peaked for the season yet. And then flu, which is just flu season is rapidly upon us. We want to make sure that we're thinking about respiratory hygiene and respiratory illness prevention. Not just from a disease specific standpoint, but thinking about just overall transmission of respiratory illnesses and what can we do here. And just to kind of drive home this point, influenza positive tests usually peak kind of around November. So essentially we have kind of the beginning of the year, and then we have a little bit of a slowdown in the summertime, and then kind of towards the end of the year, we tend to see a lot more cases. And just for everyone's awareness right now, we're dealing with flu A in case you keep track of that. And so this knowledge does help to drive vaccine administration and vaccine development. So I do want to just kind of bring this back. I know we've seen this a lot of times within COVID, but I just want to remind everyone about the fact that there are actually multiple layers of prevention that we can use for all respiratory illnesses in schools. And not everyone is going to be able to use every other one. In other words, RSV does not have a vaccination, but when we layer all of these pieces together, it still can help to reduce spread, and it can reduce the burden of disease on hospitals. And it can also improve the ability for early childcare centers to stay open and to reduce absenteeism. So there are some benefits. So basically the first one we're going to talk about is vaccination. And obviously this was originally made for COVID, but we'll talk about it some more. So a couple things to think about. Number one is, like I said, there is no vaccine for RSV, okay? And that is an unfortunate thing. I know that there are some kind of considerations in the works right now, but it's not something that we have available. And so it's really important for that reason to try to prevent what we can prevent. And right now, those options are flu and COVID. And essentially, flu and COVID together are two vaccines that we want to continue to remind people about. I know that people are kind of feeling, again, tired of hearing about COVID. And then, I think it's just important to continue to remember that flu is still something we have to think about. So, and on that note, so for everyone's awareness, if anyone didn't know, the new Omicron bivalent booster is available. So if you have not received a booster since Labor Day, that means that you are not up to date on vaccination. And this is available for everyone ages 5 and over. It is not yet available to those younger than 5. Only the original vaccine is available. So it may not apply to everyone, but some of your older students, all of your staff members, this would be relevant. So a couple things to think about. And obviously this is still being understood a bit, but so far what we know is that these boosters do provide greater protection against infection and transmission by boosting our first line of defense, which is those antibodies that are going to help to reduce, they like neutralize the disease. The second thing that's really important to know about is longer protection against infection and severe disease. And this is one of the things that we hope and we think is going to happen. There is a caveat, of course, that this can only be collected in real time. So we will really only know the answer in a few months. But given prior experience and early vaccine trials, we expect it will be true. And then most importantly, broader protection. So right now, remember that Omicron is kind of the main still circulating variant. And the idea is that we want to make sure that we're protecting for the most current version of the virus that we're seeing within the community, and that is Omicron. The benefit here is that this is also being able to protect against the original version. So the one that we had the original protection against from the original vaccine. So in other words, the ability to create antibodies that see more virus parts and attach more strongly to the antibodies than we have now. Okay, so again, some reasons to consider getting that booster if you haven't done so already, especially in anticipation of respiratory virus season that's already starting. And we can see that the vaccine has been of importance and protection. So hospitalization rates have been 2.7 times higher in those who have been unvaccinated compared to those who have been boosted. And that is up until this point. So there's been a recent increase in COVID hospitalizations and unvaccinated Chicagoans. You can actually see from January until now that there's kind of an upward trend right here. Since Omicron became dominant in Chicago, unvaccinated people had a 2.2 times higher risk of being hospitalized compared to fully vaccinated people, and 2.7 for the booster. So in other words, if you've had your primary series, there's still a significant protection. And if you've had the booster, it's a very significant protection. Okay. The other part of it is that booster reduces the likelihood of reinfection for both prior Delta infection and prior Omicron infection. So 6.8% of those not boosted since their Delta infection have been reinfected compared to 5.6% of those boosted. And 3.2% of those not boosted since their Omicron infection have been reinfected compared to 2.4% of those boosted. And overall, one of the things that's really concerning is that still we're looking at kind of the younger Chicagoans, and compared to the rest of the age groups, there is a pretty significant difference in the number or the percent that have received vaccine if they have been eligible. So you can see of those 5 to 11 years old, which I know is a little bit older than most of your students, but only 2.1% have received that updated vaccine. So there's definitely a need to continue to message and promote this, especially right now. Now is the time to get it before people start gathering for holidays and things like that. So I also wanted to talk a bit about the flu vaccine, not just the COVID vaccine, because again, children are actually highly impacted by the flu. And it is recommended annually for everyone 6 months and older by the end of October or as soon as possible thereafter. If students have not received a vaccine previously for flu, they will also need a booster if they're under 7 years old. So in other words, they'd have to get one, and then about a month later, they'd have to get another one in order to be fully protected. So especially now, you know, even though I know Thanksgiving is coming up next week, and we're already starting the flu season, the soonest that people can get vaccinated is the ideal situation, because we're already kind of in the thick of it. And so we want to make sure that before people get exposed, they are vaccinated. And it can be given at the same time as the COVID-19 vaccine. It might make arms a little bit sore, it might make people a little bit sleepy, but it is still appropriate to give both at the same time. And this is just showing that influenza vaccine for those under the age of 18 has been notably lower than at this point last year. So if we're taking a look, last flu season to this flu season, we're actually seeing quite a bit less for this group. Flu vaccination coverage for all children as of the week ending October 15th is similar to the same time, but lower compared with October 2020 as well. So in other words, kids are not getting vaccinated for flu and they are very vulnerable. And just to kind of give some additional information, if anyone does have interest in sharing this, we do have it on our website as well. But this upcoming Saturday, actually it's next Saturday, this one, but oops, I'm sorry. At Kennedy King College, we do have a vaccine available for both flu and for COVID, which is this coming Saturday. And then we do have some dates as well in December in at Wright, Olive Harvey, and Daly. So there is the capability of getting both vaccines. Also for those younger children, because I know you are seeing a younger population. The COVID primary series are available for 6 months and older. So anyone who, even if they're not eligible for that booster, they can at least get their primary series if they haven't done that. So that might be a group of students that you can help there. So we also still do have our Get Vaccinated at Home program, and in-home vaccination is available to all Chicago households at no cost. Up to 10 people can be vaccinated, so you can invite family or friends. They don't all have to live in the same household. You can have a vaccine party if that works for you. But essentially, we do offer flu vaccine at this event as well. So if you know of anyone, if you think your families could benefit from this information, please have them get this information and to call for an appointment. Okay, so we're going to talk a little bit now about some other ways that we can protect against respiratory viruses in schools. And as we've discussed, you know, there's no vaccine for RSV, so we need to kind of develop some other strategies. So with regards to COVID and regards to other diseases, masking is required if there's someone who's experiencing symptoms. And this is truly because of COVID. If somebody is, you know, coming to school and they're starting to develop symptoms and they're not picked up yet by their parents, it's a good idea to put a mask on. Obviously, if they are under 2 years old, they shouldn't be wearing a mask just as before. But if they are experiencing symptoms, this is the time when it's required. With regards to COVID, also when they're returning from isolation after testing positive days 6 to 10, or from days 1 to 2 after 1 to 10 if they've been exposed, or if there's an outbreak, which right now is greater than 3 cases per classroom, or otherwise under our discretion. This is actually going to change a little bit soon. Oops. There's other such situations in which this is encouraged. So at large events like dances, performance, indoor sporting events, I know some early child care centers have social activities like maybe a parent greeting or like a small children's winter performance. So those are all times to heavily encourage vaccination or to encourage masking. At medium and high community levels, also universal masking is a good idea. And then also in seasons with high non-COVID respiratory illness. So in other words, as we're approaching flu season, as we're approaching respiratory syncytial virus season, it's still not a bad idea to recommend masking in these circumstances, because even if we're not protecting against COVID, it can be very beneficial to protect against some of these other viruses. And kind of going back to this experiencing symptoms component, you know, sometimes you have kids that are sniffling a little bit, that maybe are not sick enough to be excluded from childcare. They don't test positive for COVID, but if those parents could be encouraged to mask their kid, if it's possible to encourage those kids to mask, then that can be of benefit to potentially reduce spread. And just as a reminder with COVID community, regardless of level, if you have symptoms or test positive or have an exposure, those are reasons that you should be masking. Then we're going to talk a little bit about physical distancing. You know, we haven't really been quarantining. We're not necessarily cohorting, but it's still something to think about. As a reminder, isolation is for those who've tested positive and quarantine is for those who have been exposed. As a reminder, no one has to quarantine anymore if they have been exposed, regardless of their vaccine status. Last year, if they had not been vaccinated, they would have to stay out of school. And as a reminder, isolation guidance didn't change. So if somebody tested positive, they would still have to stay out of school for the first 5 days, and then they would have to be able to mask when they return. But I think this is important. If you're sick, stay home. You know, if we have students that are testing negative for COVID, but they have a fever and they're coughing a lot, then they should still stay home until they're fever free for at least 24 hours without the use of fever reducing medication. So the kind of the way that I envision this is that, you know, you have a kid who is very sick. They obviously have symptoms. They might have a negative COVID test. They should stay home. You have kids with the sniffles and maybe they are not feeling, they're otherwise feeling great and they're eating, and, you know, you normally keep them in school. Maybe if we could encourage parents to mask them, if we can get that to happen, that might help a little bit with reducing spread of respiratory viruses. And then last, 2 more things, layers of defense against respiratory viruses in schools. So promoting screening and testing for illness. So with COVID-19 testing, we want to encourage testing, usually rapid antigen at day 5 after an exposure. Serial testing, meaning testing more than one time, might identify cases sooner after the exposure, so they're not in school for as long. Increasing access to testing in an outbreak, at least 2 times per week, although 3 times a week might be helpful. And then we don't really require screening testing anymore. The CDC doesn't really recommend it, but for a high risk activity, like, you know, if you have certain sports or areas where people are kind of really interacting very closely, then it's not a bad idea. So some of you may know this already, but over the spring, we did a pilot of something called Test to Stay, which is previously a mechanism for people after they had an exposure to COVID. They would actually stay out of school and quarantine. That was what was previously done. In the spring, as an alternative to that, we did this program in which people would test twice within the week after they got exposed. So between day 4, between day 1 and day 4, they would have the first test. That would be a rapid test. And between days 5 and day 7, they would have the second test. And if the test was positive, they would stay home and isolate, and they would return with a mask. And so this was for students that were 2 and over. And we actually did pilot this in a childcare. And what we find is about 3% to 4% of those students that were in the school end up testing positive if this is adhered to. So in other words, although we don't require quarantine, although we don't require testing anymore, just knowing that it is helpful to kind of identify those cases, and that really helps to keep the schools safe. And I think, you know, again, kind of thinking about other respiratory illnesses, this is a good reminder to If you're sick, see your healthcare provider. I think, calling the pediatrician to just kind of talk a little bit about the child's symptoms can help us really understand the burden of disease. The healthcare provider can decide if it's appropriate to test not only for COVID, but also for RSV or flu, so that the appropriate steps can be taken potentially for treatment earlier rather than later. So kids are not really, really sick when they need to see their provider. Connecting higher risk individuals to the appropriate treatments more quickly for influenza and for COVID-19 can be helpful. And so essentially being able to kind of make sure that children are treated sooner rather than later. Also for awareness, even though I didn't put this on the slide, it's because it's not related to testing, but there is a preventative medication for RSV. It's for higher risk individuals. So if you have students that, are younger, I think just, again, continuing to message to visit their healthcare provider because it's a medication that needs to be given under their direction. But for higher risk students, they may be eligible for it. And then I guess last but not least, ensuring healthy environments and effective ventilation. So, and practicing good respiratory hygiene. So in other words, in places where you can, opening windows, if you have a HEPA filter, that can be helpful. And with regards to healthy environments, practicing good respiratory hygiene. If you need to cough or sneeze, using a tissue, then disposing of it properly into the trash, making sure that hand washing is part of the daily curriculum, washing hands with soap and water before touching the face or mask, after touching high touch surfaces. If soap isn't available, having hand sanitizer available with at least 60% alcohol, routinely cleaning and disinfecting high touch surfaces and toys. If you follow this link, which I can also drop into the chat, there's some free resources about updated cleaning and disinfecting protocols. And then also preventing sharing of cups and utensils and linens. If you're seeing a lot of respiratory illness, making sure that students are not bringing their like stuffed toys to school and playing with them at the school. So that way they're not sharing them amongst each other. With some of these other diseases like RSV, fomite transmission does play a role, meaning that, you have a 3-year-old who sneezes and then, maybe doesn't have the right tissue and doesn't wash his hands and then, goes and plays with the toy and then his friend plays with the toy. And so as opposed to kind of the spread with COVID, in which that is still the case, but not as much related to fomite transmission. So cover coughs and sneezes. Remember to wash your hands. There's some really good resources right now on the American Association of Pediatrics website. So you can look there for some resources too. And then, like I said, increasing ventilation, opening windows when possible to let in fresh air, investing in replacing or upgrading HVAC systems, using HEPA filters in high risk areas, especially like places where people eat and classrooms, especially in early childcare settings. I think this is a good strategy in places such as like the infant room in which they can't mask, and a lot of the rapid tests are not technically labeled for that group. Having kind of interventions for increased ventilation can be beneficial. The CDC does have a really great toolkit that's available, as well as a safety checklist. So again, I can share these slides or share the safety checklist just so you have this information. And then kind of just broadly, I wanted to talk a little bit. I know, again, COVID is not the top of our mind, but I just wanted to kind of tell you about some things that are going to be changing soon. So essentially, with a single case in a cohort or classroom, this is an area that I know for some of you who have been reporting to us, it's something that you can continue that you can for now continue to report to us, but in the coming weeks, there's probably going to be a shift to only requiring clusters to be reported, and the definition of a cluster will be changing. So with regards to a single case in a cohort or classroom, just some actions that we want to take are excluding individuals who have tested positive for 5 days, with day 0 being the date of symptom onset, ensuring the positive individual returns wearing a mask if they're eligible to wear a mask. If a person can't mask, you can still help them. You can either exclude them day 6 to 10, or one thing we can do is take 2 negative rapid tests 48 hours apart, no sooner than day 6. Notify classroom cohorts of the outbreak via the parent letter, encouraging masking of all individuals who can mask. So, maybe it's not the students, but the staff should be able to mask, and trying to spread people out as much as possible. And when it's those younger children, encourage rapid testing when we can at days 5 and day 3, if available. And then maintaining awareness of any additional cases. And so that way we can kind of see if any additional measures need to be taken. And then one of the things that we want to put in here as well is just if there's 5 cases or 20% of a cohort or classroom, this is what we're going to be, and we'll be sending out some messaging too as this happens. But essentially, the idea is that if there's 5 cases or 20% of a cohort that are affected, that's really when we're going to want to be notified of it. And I'm going to show you a little bit more about our tool, but we do have this REDCap tool, which I know you've been using your REDCap to report to us up until now. But this is a new tool that helps for us to understand other diseases that can be potentially reported to us. I'm going to stop here for a minute because I know that we have some questions in the chat. I was just going to see if there's anything urgent, and then I can go on to the next page, and then I can answer all the questions at the end if that works. Okay. So one of the things I just wanted to highlight is that throughout the pandemic, it's been very clear that for schools and early child care centers to achieve their goals of keeping students safe and providing an education and a place for social and emotional learning, it's important to have easy access to changing guidance and how to implement that in school settings, as well as resources, so we can message new changes to your communities, as well as to provide staff with training and information, especially if they have to take on new responsibilities. And then also support consultation about outbreaks or clusters. Sometimes that just comes in the form of reassurance that you've done everything that you can do. But just to improve the communication between the health department and our other departments. And so being able to continue to collaborate with administrators and leaders from early child care centers and schools is really important to us. And I know that we've really appreciated partnerships with many of you. And so to facilitate this, we've worked on very hard over the summer. It used to be just for COVID, but we've made it into something larger. Something called the Chicago HAN. So the Chicago HAN is actually a health alert network. It was originally designed for healthcare providers, so like physicians, hospital administrators, to be aware of any new and upcoming disease threats or outbreaks or anything that they should be aware of. But it's become very clear that schools and early child care centers need resources like these as well, so that they're not left in the dark. So this is actually what we've been building. It's a school-focused resource library that has information about communicable diseases as well as Chicago resources. So things such as There's a resource finder that was created by our maternal infant child health team. You can see something called One Shy Fam, which can help to provide some information about, finding a healthcare provider or linking to other resources in the community. We also have Connection for pregnant and parenting youth, which might be relevant for some of the people who are parents for your schools. So this is something that you would have to register for. It's at chicagohan.org. You have different subscription potential. So you could register for the early childcare or for emerging infectious diseases, et cetera, and it will keep you looped in to those materials. We have on our communicable disease HAN information about even vaccine preventable diseases and other non-vaccine preventable communicable disease. So things like RSV, hand, foot, and mouth disease. Even though this is not really a high risk, I got a lot of questions about it. So I put it on something on there about MPV. But I think more relevant for all of you, norovirus, et cetera. If you, like I said, go through and sign up, we have an access request form. You would just select that you're an educator when you're going through this list. And you could put your organization, and if you had a difficulty signing up, then that would be appropriate. As far as subscriptions are concerned, you would just choose early childhood education or even K through 12. Child adolescent health, and then you would have detailed information about these options. And there are one-pagers on this on the HAN. Again, I really created MPV just because initially we had a lot of questions about the potential for cases in children. I can use this briefly to say that it's not a very high risk to children unless they have a household member who's sick. And has actually been kind of handling them. So just wanted to make you aware of that, but also that these one-pagers do exist, so that way you can use them as a resource. And then I just wanted to highlight ways that you can reach out to our team. So if you're reporting clusters to us, you can use this link. If you are emailing us, you can email us at schoolcd@cityofchicago.org, and this will help you to see anything that is beneficial for like if you have questions and you're not sure if you have an outbreak or need to worry about anything. And then you can also call us, and this is the same line that we've been using this whole time. So please feel free to reach out. And I want to say thank you. I did want to, before I formally take any questions, just share with you a little bit about our reporting page and the HAN page, just because I think I think it's nice to see. So let me just go ahead and share my screen again. Can you see this?
Not yet.
Not yet. Can you see it now?
Yes. Mhm.
Perfect. Okay. So I just wanted to show you, because I don't think that the PowerPoint slide fully captures kind of what is so great about this form. But we have, like, this is the communicable diseases page. So we actually have kind of this whole disease list. And we have information about acute gastroenteritis, for example, because sometimes kids get diarrhea and you don't really know actually what causes it, to norovirus, to flu. And the really nice thing that I'm very proud of is that we actually have handouts on a lot of these. So like, for example, if you're looking at RSV, we actually have a one-pager that we've created. And it's actually like the one that you saw for MPV. It's actually available in both Spanish and in English. So if your communities are Spanish speakers, that's available. We also have a parent letter kind of just talking about, increasing cases and reminding people to wash their hands. So we have a little bit of information there. And then also we even have this community letter, which is kind of talking about a lot of these details that I just presented about in terms of keeping people safe. But these are actually templates. You can borrow them. You can use them to communicate with your school community. You know, we have lists of where vaccines are available. So all of this is for you to be able to share with your school communities. So and just even within this, that's the communicable disease component. But within school health, like I said, we do have other programs here. So early childhood, you can get information about WIC. You can get information about other resources and just additional information. So we also have links to upcoming events and when any new guidelines change, that is available that we will be sharing with you too. So like I said, when that new reporting system is available, that's going to be something that we focus on too. And then last but not least, I do want to show you our reporting page that we're working on and should be helpful. So if you went into school health again, and you could bookmark whichever of these, and then you went into communicable diseases in schools. Which is apparently being a little bit slow right now. I'm going to stop sharing just for a second to see if that helps it work a little bit better. Yes, of course. Can you see this? Okay.
Yes.
But essentially, using that red cap that's at the end of the presentation, as well as there's the link from the HAN page. We've actually created a form for a variety of different diseases that you can report. So not just COVID, but if you were reporting COVID, you can basically upload. We have a sample line list, which is an Excel document that you can download. And this would help you to submit any clusters that you have. So when you have multiple cases in the same classroom or the same shared space, and then also you can upload that file there. But then we also have details such as, you know, if you wanted to, even though this is not a reportable illness, say you had a lot of hand, foot, and mouth disease and you just wanted to make sure that you were doing everything possible, you could select other and write hand, foot, and mouth in here, and then go through and just put your information in and hit submit. And then we would be able to kind of, that would trigger to our team that you would want some information, and we can call you back and just make sure that you're doing everything that you need to do. So a lot of resources to hopefully help with some of this. So with that said, I'm happy to take any questions.
Yeah, there's a couple of questions that's in the chat box. One, can you provide a little more clarity for positive cases in an infant room since they don't wear masks?
Yeah, so I think there's a couple of things I would do there. So the first thing I would do is the positive case, I would probably keep them out for the full 10 days just because there's no way that they can mask. For the others that are just exposed, what I would do is I would require the staff members that are working in that room to mask. I would try to prevent those staff members from switching rooms if you can. I know that's not always the easiest thing to ask, but if it's feasible to do that, I would. I would try to get the staff members to test as well. So like, I know for some of you, we were able to connect you to tests, you know, through one of the government programs. So if you're able to kind of continue to do that, I think that's great. And then also, just making sure, and for those staff members who can't test, I would do so at day 5. And then where you can, I would try to separate people as much as possible, but that's kind of also where I know it's, again, not always feasible in an early child care center, but if you can maybe since you can't open windows most of the time, maybe having like a HEPA filter that you can get for that particular room that can help to kind of clean the air and hopefully provide a little bit more protection for those little ones.
Thank you. There's
Yeah.
one more. Do you have to complete all COVID boosters before you take the bivalent booster?
You do. So essentially you would need to, no, I'm sorry. So you would need to complete your primary series. So for example, if you had a first dose of Johnson & Johnson or 2 doses of Moderna or the Pfizer vaccine to be fully vaccinated, then once that has been completed, you can get the booster. So in other words, you don't have to have gotten a booster last year or over the summer if you were eligible. As long as you've had those 2 primary series, and then it should be a couple months after that. So in other words, after those, you can get that new booster. And I strongly encourage you to do so before school or before the bad season starts. So.
Thank you. I don't see any other hands up. And those were the 2 questions that we had in the chat. I was scrolling back through. I don't see anyone.
Sounds good. Is there anything else? I'm gonna I'm gonna plug a couple more things. I
Okay,
really
go
want
right ahead.
to get the school hunt. So I'm just gonna make sure that if anyone hasn't seen it, although I will be sharing it as well. I really want people to sign up because I think it's gonna be so helpful for communication and just to reach out. And if you go to the chicago.han.org/school health, that's what you want to sign up for. And then you can link to all these other departments through there.
Perfect. Thank you. Will you be able to share your slides? I
Yeah.
got people asking. Okay, great.
Yeah, I'll share them with you.
Great. And then
Okay.
we'll be able to send those out to everyone. So,
Absolutely.
again, Dr. Funk, thank you for taking time today. You just gave us some really critically important information, especially because of the age of children that we work with. But it also reminds us to keep ourselves vigilant and how important vaccines are, and even, looking at the data that you're showing that there is that impact that has happened across our communities because people have been vaccinated. And then you can see where the impact is when it hasn't happened. So
Yeah. Thank you so much. I'm really glad to be here. And, I just really hope that the season can be a good one for all of our littles. So, I just thank you so much for your partnership and we look forward to communicating with you. So
thank you. Thanks again.
thank you.
Take care now.
Take care.
So I thank everyone. Wanted to make sure that we had an opportunity for Dr. Funk to go through and provide that information so that we're all aware of what it is we all need to do. And again, we're entering into the holiday season. I'm sure you can hear it, struggling with something here. I have blamed friends for taking me to see Wakanda and said that's why I'm sick, but it really isn't why. But I'd like to point at things and point at people. But what I want to do is thank all of you for everything that you're doing every day, but also to remind all of us that we do have some responsibility. We're working and providing services to our youngest citizens and trying to keep them as healthy as possible. We know is really key in their ability to actually be in program and to get the necessary services that you provide. So everyone just stay the course, stay vigilant, stay healthy. I hope you all will enjoy a very fruitful, and I say fruitful because I can't wait for some fruit-filled pie. But I just want everyone to have a really great holiday season next week for Thanksgiving. But again, having her speak to us just before a holiday, I just hope everyone would take it seriously and think twice about what it is you need to do in protecting yourself, protecting your friends, and protecting your family as we go through this holiday season. And so everyone, please, as I always say, take care of yourself. Just like being on a plane, put that mask on first because you can't help others if you're not well yourself. And so please take care of yourselves, stay healthy, be mindful of what's going on around us. And then I can't wait to see you again next month. And so have a great one, everyone. As always, as always, if there's anything you need from me, I'm available. And so is my team. So thanks for all you do, and we'll talk soon. Have a great one.